new preventative guidelines soon. Joining me now is Dr. Susan McLellan, an infectious disease expert at Tulane University School of Medicine. Dr. McLellan, thank you so much for joining us. How concerned should we be about this new development?
Well, I think the most important transmission risk for Zika virus is going to continue to be mosquitoes. Sexual transmission clearly appears can occur, but is not going to be the major type of transmission. However, if somebody is trying to get pregnant, then having sex with somebody who has Zika virus or who potentially has Zika virus may result in a transmission to the woman trying to get pregnant, and therefore result in infection during early pregnancy. So it's certainly reasonable to defer attempting to get pregnant with someone who is at risk of developing Zika and transmitting it, or otherwise having sexual contact with somebody who may be in that incubation period.
A lot of the focus with the Zika virus, Dr. McLellan, has been around pregnancy and pregnant women, and that's who it affects most severely. I want to read you a question from a Twitter follower, Lori. She says, if a young lady is bitten, how long until she can try getting pregnant? A week, a month, forever? What are the guidelines for that? What is the period in which the Zika virus stays in one's body?
So the simple answer is it's not completely well known. If there's any possibility of late persistence, this seems profoundly unlikely. This group of viruses typically has a relatively short incubation period, runs its course, and then is gone. So a fairly conservative, in other words, a fairly safe guess would say maybe a month, 28 days. There are not formal recommendations out by all the players in terms of everybody agreeing that we're sure that this is the right, recommended by some authorities as basically 4 weeks after a potential exposure, you should be pretty sure that you've either had an unknown case, had a known case, or you're not going to be a case, and that it should be safe.
And it runs its course without any treatment. It just runs its course in your body.
Absolutely. Like a lot of other viruses, one of its relatives, dengue virus and so on, we have no specific antiviral or anything for it. And for most people who get Zika virus, it's a quite benign illness. I mean, it may not be fun, but you're going to have fever and rash and joint pains and so on, but it will, for the vast majority of people, be over with.
Pretty benign, running its course within a month, just like a lot of other viruses that you just mentioned. I want to get this last question in because we are running out of time. You are a tropical disease expert. Ground zero for this outbreak is in Brazil, same place as the Olympics, which are going to be held there just in a couple of months. Should they be moving the location of the Olympics?
Well, I'm not going to comment specifically on that. This is a disease that is entirely preventable by reducing your exposure to mosquitoes. So people who are going there should be following very, very good mosquito precaution recommendations, which they can get from the CDC website, a good travel clinic, and so on. And the site should be putting in place as much vector control measures as possible. And then women who are considering getting pregnant should perhaps make the decision not to attend.
Dr. Susan McLellan, thank you so much. Really good information there. Thank you.